were going to reopen, and then they said if the weather hung in there long enough, they were going to try to get the weekend open.
Nice.
Oh, that's fascinating. Well,
You can tell the pandemic too. We had our, getting ready to have our golf advisory meeting, and rounds were up like 35% the last month.
Oh, yeah. I believe it.
Well, people go stir crazy. I got to get outside and do something. Even if I hate golf, I'm going to go.
Right. It's one of those few things that you can do and like comfortably do safely.
Yeah. Yeah.
I know we went to Costco on Sunday.
Oh, wow.
No, on Saturday. Just to do like a regular Costco run there, out of pretty much what we were looking for. But then we ended up just trying to think through like next steps. Like, I ended up with snowshoes, a drone, like.
Get it while you can. Better get it while you can. I got to do something to do. Well, we're looking forward to it. I got a snowshoe about 2 years ago. It's awesome.
It's great.
I love it.
That's in the library.
Oh, yeah.
Library of things when they're in red snowshoes.
yeah, because I need to give you maybe
This year I'm going to go up to 49 degrees north. They
I can
try their trails. They said that they're really good. They're not as good as Mount Spokane.
Yeah.
The other one I want to go over is Silver Mountain.
Isn't it fun?
There's a place, it's just, what is it? It's off 395. It's mainly like a horseback riding. It's a wilderness. It's like the wilderness or something. Or maybe Slavin.
Which way are we going? North on 395?
Yeah, toward Pullman.
We're going to Pullman.
Yeah. Or it's another place. Something TJ Slavin or something.
That'd be cool.
Recreational area. And when it snows here,
Look at a puddle.
it's really.
Second with you.
Yeah.
I just want to know, can I take off?
No.
I don't know. Good morning, everyone. I know that GSI has a special, they have their economic forecast today, so it may be, we may have fewer people here today.
I'd like to see that crystal ball.
Yes. I think we're all interested in learning more about the economic forecast. We are after 8, so I think we could go ahead and get started. We're going to have Steve go over the dashboards, and then Lyndia Wilson, our incident commander for COVID, is going to give us a couple of updates. We had a big conversation yesterday with local hospitals, and then also this group had requested an update on our vaccine planning and distribution plan. So we've already started doing a lot of that, so we can update you there as well. Dr. Velasquez couldn't be here this morning, so I'll cover a couple of things under my area, and then we can talk about next meeting time. So if anybody have anything they want to add to the agenda that we make sure we get? All right, Steve, take it away.
All right, good morning, everybody. So just going to go through the case data. As we know, it's really up there. In the prior week, so that's November 8th through 14th, we had 1,495 new cases. That's about 450 cases more than the previous week, putting our daily average to about 214. For the 2-week total, so basically the month of November 1st through 14th, we had 2,539 cases. That is nearly double the prior 2-week, and that would be the last 2 weeks of October. As far as age groups affected, I will say that 81% of new cases are under the age of 60. Really no particular driver within that age group of 10 to 59, honestly, that's higher than the other, a little bit more so toward 20 to 29 and 30 to 39. Race data right now, just so people know, with our websites and on the dashboards, that is currently behind. That takes a lot of manual data entry. It's not part of the data report that we always get back for the positive case. So that is a little bit behind. I apologize for that. Our current rate per 100,000 new cases in the past 2 weeks is at 493, and that was as of the 14th. It's actually a little bit higher at this moment. In the prior week, we had 55 new hospitalizations. There were 42 the previous week. Currently hospitalized, both COVID confirmed and suspected in Spokane County is 112. There are 81 Spokane County residents currently hospitalized. There were 9 new deaths over the prior week. 3 individuals in their 60s, 2 in their 70s, 3 in their 80s, and 1 90 or over. There were 10 deaths the previous week. Our testing has gone up quite a bit. So the average number of individuals tested daily between the November 1st and November 7th rate was 218. Really looking at that, that's about 1,124 tests a day. That's gone up from 942. Our positivity rate is really high right now at 16.1. That's up from 11.8%. For the healthcare system readiness, we are looking at about 59 to 60% of licensed beds are occupied by patients. Total beds has stayed the same. And when it comes to percent of licensed bed occupied by COVID-19 patients, that's at about 6%. Our case and contact metrics are a little behind in reporting, but they have gotten lower with the higher caseloads. We're looking at about 42% have been reached by SRHD folks within the past 24 hours for cases, and about 92% of contacts have been reached within 48 hours, which does exceed our normal metric. Our business technical advisors continue to be very busy right now. Between November 9th and November 15th, they performed 208 consultations. To date, they have done 2,752 referrals that they've completed. Food security, we're really staying at about the same. It's gone down a little bit for pounds. Our new UP applications are 665 between November 9th and November 13th. Our child care remains steady. Those metrics have not changed much. Unemployment insurance claims, again, this is November 1st through 7th, so we will see a difference. There were 1,510 new unemployment insurance claims. That's up by about 500. The industries most impacted are food services and drinking places, especially trade contractors and professional and technical services. Finally, when it comes to outbreaks in long-term care facilities, there have been 54 total to this date. 24 of those facilities are currently under outbreak, which is 2 more facilities from the prior week. And just a little bit more of a generalized idea of what's going on as far as outbreaks. I'd say it's pretty much all over the place as far as sector goes. A lot in healthcare, a lot in K through 12 schools, long-term care, a little bit fewer, congregate housing, and then pretty much all over the place within Spokane County. And that concludes my report. If there's any questions?
Steve, this is Mary Cuny. Will you be able to send that out to us so we have those numbers?
I think it's already sent. I think it's in the meeting invite and
Okay.
it's in the meeting. Yeah, we have it. Yep.
Okay, and so then you're saying you're not really seeing, it's just community-wide, you're not really seeing any certain sector. And when you say schools, it's not an outbreak in a school. It's just they're getting it from outside and bringing it in.
Well, to declare it as an outbreak with the school, there has to be transmission within the school. We have to have identified transmission of at least 2 cases within the school to consider that there, and there have been 6 to this point.
Okay, 6. When you say point, what do you mean? What's the time frame?
That is between November 2nd and November 15th.
Okay, thank you very much.
You're welcome.
Other questions on the data?
So I guess part of the question off of what Commissioner Cuny was saying is, so when we talk about the K through 12 transmissions, and I don't, this may be a granular discussion, but I have my brother and sister-in-law work in the school system. And so it tends to be the staff to staff. They're not seeing it coming through students, but they're saying, like, one staff went to a staff meeting and suddenly you've got 14 staff that are under quarantine. And that's why I think we're starting to see numbers, but again, it doesn't seem to be related to the students. at least the anecdotal information that I'm getting.
Yeah, so we're actually working with the superintendents, and 2 schools in the area have signed up to do testing pilots with the state, because that is where we're seeing more of the issues, is with adults that work at the school versus the children at the schools. But I think, from what I'm hearing from the schools, part of the issue, there's only so many only so many substitute teachers, so it's kind of a fine line. So Dr. Velasquez and I have had some calls with superintendents, and in going through the rollback stuff from the governor, we're going to continue to dig into that this week to see, where we can kind of go with that. We also have a testing strategy that we're working on here at the health district, because we've ordered additional tests through our Box in the Virus funding. And so we're developing a strategy for where we need to get those tests out to the community. Other questions? Not seeing anything in the chat yet. Okay, Lindia, do you want to update us on the hospital conversation and the vaccine distribution plan?
Sure. So, good morning. And as you can tell, we're kind of in a bad place right now. Cases have doubled since October 1st, and we're just seeing such huge numbers that even our surge capacity to do cases and contact investigations are getting very difficult for us. We are holding a lot of different calls with different sectors to try to figure out kind of what we need to do going forward. And as you know, there's pandemic fatigue, and our compliance in the community is kind of low right now. And that impacts our ability to do case and contact investigations. So I am going to ask for some support as I start talking through my different components here, and maybe reach out to some of you after this call. We have been holding meetings with the healthcare system leadership on their concerns around capacity. And Ready Healthcare Coalition has been leading those calls, and they've been doing them for the last 9 months, and working with staff on how they can manage the workload in the hospital setting. So the Disaster Medical Care Coordinator Hospital is Deaconess. And Deaconess works hard to try to level patient load out across the system. The state is also allowing the hospitals to kind of self-regulate, so they can decide if they want to do less non-essential surgeries, so they can free up some beds for the COVID patients. We are talking to them about how to really offload their low acuity patients and think through where they could be placed. And they've been having these discussions for a while, but I think it's coming to a kind of a head at a stress level. And so those discussions have really ramped up. Their biggest concerns is staffing. So they have beds, they can open up more beds, but if you don't have the staff for those beds, you can't utilize them. So we may be putting up requests to the state through the county to request some additional medical support. I think we're holding another call with them this week just to understand kind of where they're really at and what kind of medical staffing they actually need before we do that request. We are also holding a lot of calls around community testing. And if you remember, we had a community testing site back at the beginning. And the problem with a community testing site is it takes a lot of staff. So if you already have staffing needs, it's hard to use some of your staff for a community site. So in the discussions, the healthcare entities really just want to continue to do their testing in their regular manner at their sites and increase it as much as possible. Chaz has been a great partner, and they continue to try to ramp up and do even more than any of the other entities to do some more community testing. They've really opened up their clinics, and they're planning on some other type of venues to really help increase the load and the need in the community. We have purchased a quantity of tests, and these are self-administered tests, and then there's also tests that you have to have a medical doctor provide. These tests will be prioritized for outbreak settings, congregate living, long-term care, homeless, those without insurance that can't get testing, really places that we want to keep open. So we want to keep the staff there. And the staff have really been working on kind of how to utilize these for the best impact in the community. And then we are continuing our mobile triage and testing at the shelters to really minimize outbreaks. And we're using nursing students, the Medical Reserve Corps, and our own nurses to really help manage those testing. And they're out there every night at the shelters and working long hours to try to minimize that. We really don't want an outbreak in our shelters. That's a really high-risk population, and that alone could overwhelm the healthcare system. As Amelia mentioned, we have been working with the schools, and we really are hoping that they will pause for now and not bring on additional students. The staff have been working very closely with them, and many of them are doing this on their own. They realize that they're having staffing shortages, and they can't continue quarantining and isolating. We've also been working with the schools that do have more cases than others, and sometimes it's a grade that has to be quarantined, or sometimes it's actually a wing of the school, and trying to keep those schools open, but also needing to manage what they're seeing in those schools. Our isolation facilities, we've had about 50 between the two facilities at Catholic Charities, Immaculate Heart, and my place. And that seems to be going pretty well. Our one need in that area is some support around transportation. So we use MedStar, but MedStar gets maxed out, and sometimes we need an extra driver in a van or something that can transport patients. So this is taking them either from the ER or the shelter or someplace to the isolation facility. And the city kind of came to mind that maybe that's something that maybe the city could help us with. There's a lot of barriers, there seems, to transporting COVID positive patients. And so we've reached out to different companies, and they really just haven't wanted to help us with that. We are doing some research around that area and have identified maybe a couple of sources. But again, maybe STA or somebody else could help us with that when we need it. The business guidance piece is also getting very overwhelmed. Businesses wanting to really understand the new guidance and wanting to see if the events that they were holding still can go on. And we're really getting inundated with those kind of requests for maybe approval, and also wondering if maybe that would be a role for maybe GSI or the city to help us just with that guidance piece. We are really focused on the businesses that are having outbreaks and really helping them trying to manage the outbreaks versus kind of that approval of just how they're running the business or trying to be safe in the business. We did hold a meeting with Commissioner Cooney last week on food security issues and gaps. The staff really talked about what the coalition has been talking about and seeing, trying to look at geographic access to food and the populations that potentially have a food insecurity. And I believe the staff sent some proposals to Commissioner Cooney, and we thank you for that and helping out that need. We're distributing about 5,000 food care kits and 4,500 PPE kits to different agencies that are getting that out, and that's going pretty well. So before I get into the vaccine piece, I just wanted to kind of reiterate that this is really a community responsibility. We really all need to do our part with this to decrease infections. If all of our sectors can really promote messaging that resonates with your sector, that's very helpful, because everybody kind of, schools, there's going to be different things that resonate with the schools, and the businesses, there's going to be different things that resonate with them. I think we really need to put out some strong messaging about it's not in the business, but when you're home or out in the community that you're picking up this virus. And so how can we really strengthen the message to employees that they really need to try to be responsible outside of the work setting, because they're bringing it back in, and that's where we're seeing it. So any type of enforcement or messaging or anything that you can do in each of your sectors, that's much appreciated. We were also talking with the state and saying that, the hospitality association or the different sector associations could really be putting out some strong messaging to their constituents and really talking about being responsible and helping us with this pandemic. So I'll pause there and see if there's any questions, and then I can launch into the vaccine piece.
I just want to clarify one thing on the pause related to students. We have still been supportive, like within the governor's rollback guidance. I know we had questions from SPS yesterday about bringing back their second graders. And that was already a plan that they had in place, and that meets the definition of early learner. So just wanted to clarify, we didn't pause SPS in second grade. That's going forward. Because that's probably a question we might get. And then, Linda, on the transportation piece, I know you specifically asked maybe about the city. Since Mayor Woodward's on here today, Mayor, do you want... and I know Sarah is, who would be best for us to kind of pull maybe a conversation together? Would it be Linda and Sarah?
Yeah, I think that's a great start. Linda, what were some of the barriers that, could you be a little bit more specific on barriers to transport?
Yeah, so some agencies are just saying that for liability reasons, they are not allowing their drivers to take COVID positives.
I think it would likely have to be done via the appropriate apparatus, like our ambulances or something like that. There's some airflow issues and things like that that are high risk, so we'd have to talk through that. But yes, I'm happy to do that, to work with you, Linda.
Thanks,
Okay.
Sarah.
Yeah. If some of these patients are near the end of their isolation quarantine period, and so they're very lower risk and less likely to be infectious. So, there's at certain points where I don't think it is a liability issue.
This is Commissioner Kearns. I had a question. Linda, there's been sort of competing information put out by the state and by the Hospitality and Restaurant Association, and I was just wondering, locally, are we seeing large upticks in cases that are related to restaurants?
Steve might be able to answer that better, but I really think it's all over the place. It's employees bringing it into any type of business. Steve, do you have any information on that?
I mean, the most relevant information, there were 2 new outbreaks in the past week within the food service restaurant areas. I think it's a matter more of who is working within those sectors. Often folks that are working in multiple jobs, traveling to multiple places. But we don't have any specific that there have been transmission that we can definitively link to a specific restaurant other than the couple that we had come in this past week.
Okay, and then yesterday I was on a call with the county state association, and there was a representative from the governor's office, and again they were looking at statewide numbers, not specific to one specific county or region, but because I believe we heard the state health officers say that restaurants were number 1, and yesterday during our WASAC meeting, the representative from the governor's office sort of corrected that and said that he was claiming restaurants were the number 1 behind healthcare. Do we know our spreading of cases or new cases related to the actual healthcare industry? Is that number 1 here? Because they were saying statewide that was the number 1 industry or field was, I mean, folks that work within the healthcare industry contracting it at work.
That's consistent here as well.
Is it? Okay. All right. Thank you.
Yeah. So I'm going to try to share my screen. Are you able to see the phase chart?
No, not yet.
Okay. Now, can you see it?
Yep. Thank
Great.
you.
Okay, so the Centers for Disease Control came out with a playbook for vaccine planning, and that really is what the Department of Health is going by, and taking that and making our own state playbook. So the playbook is really pretty detailed and really giving us the guidance. But at the same time, the state has really been doing a great job of reaching out to a variety of sectors and engaging people to really get their input into how we are going to allocate the vaccine. This chart here has already been modified since it was published, but we are in phase 1, and that's where we're really focusing our attention. It's really looking at high-risk health workers. So just like Commissioner Kearns was talking about, that's really where we're seeing most of the cases is in our healthcare workers. So wanting to get them vaccinated. All of our first responders. And then part of that is also all of the people that are at highest risk for getting very sick with this disease. Older adults living in the congregate and overcrowded settings. So all of our long-term care, adult health, and nursing facilities. They've added 1C on this phase 1, and that includes critical workers that we don't want to lose because they're in congregate settings such as food processing, and we need to keep those industries running. So phase 1 is really what we're focused on now. We'll move into the other phases as vaccine becomes available. So as you know, it's very limited at this time. Sorry. And it's coming in small quantities. So right now we're enrolling for phase 1 with the hospitals and the healthcare settings and really focusing on them to vaccinate their workers and the phase 1 individuals. The locations that will be doing this have to have high vaccine administration capacity, ultra cold storage on site or nearby, and the willingness to be an open point of dispensing or a pod, which means that they can bring in other hospitals or clinics and vaccinate others. We're preparing to get about 200,000 doses around mid-December, but there's about 500,000 healthcare workers in the state. So you can see it's not going to go as far as we need it to go, even with phase 1. We are hearing good things about some of the vaccine. You probably have seen it on the news. Pfizer is looking at a vaccine that's about 90% effective. Moderna is just coming out showing something that's maybe 95% effective, but they're still in their trial phases and they aren't complete yet. Washington, Oregon, Nevada, and California have joined a Western Scientific Safety Work Group. And this work group is set to independently review vaccine approved by the FDA. The reason they're doing this is because it adds a layer of independent expert review to really build consumer confidence. There's been so much information in the news that potentially has harmed people wanting to get the vaccine, that we're afraid that even when it does come out, people will not want to get it. So in the state, we're going to do a statewide campaign, and the health district will enhance that campaign, but really try to build up consumer confidence. I actually saw a couple of the state PSAs out on the TV last night about the journey of a vaccine and really showing how it goes through those trials and how it is proven to be safe by the time it gets to the consumer. It should only delay the administration by a couple of days, even by this third-party independent review. And so that won't hold things up. So the state really is taking most of the workload in preparing this implementation of the vaccine. The local health departments will get some funding to have some staff to help support it. And our role really will be to enforce the communication strategies, really build on that communication and getting the message out, and then developing the partners that's needed for each of the sectors that will be vaccinated. So for example, if it's the hospitals or the long-term care, we'll be working with those sectors to get them enrolled, to receive the vaccine, and then to be able to vaccinate the population that it's intended for. We'll be doing provider education and really encouraging the provider sites to enroll in getting the vaccine. Then when it gets more to phase 2 and it gets a little bit more broadened out, the health district will use some of our usual techniques in getting the vaccine out. So we have a project called Clinic in a Box, where we have all of the supplies and vaccine that you need to go set up a clinic. And then we use school nurses, or we use student nurses, or a medical reserve corps to actually get the vaccine in people's arms. There's some work that we're going to be doing, and we'll probably use the librarians to help research this, but to really identify the essential workers in each of those areas. So for phase 1, where are all of the places that they are at, and are they connected to a vaccination site? When we get to phase 2, we'll identify who are those, where are they at, and then identify the sites that will be vaccinating them. I think I forgot to mention too, with long-term care, the state is working with some of the big pharmacies, such as Walgreens, and they will be connected to the long-term care settings to help them get the clients, patients, and staff vaccinated in those settings. We will have some metrics so we can identify how we're doing, provider enrollment, access to vaccination for high-risk populations, provider level data reporting, vaccine ordering and distribution, and vaccination coverage of each of the population groups. Okay, I think that's it for now. And if you have any questions.
Libby, this is Commissioner Kinney. I've got questions. So both the vaccines that you talked about, on the news, they're talking about them as they require 2 shots. It's a first shot and a second shot. What is the time in between them? And I mean, that's going to make it more difficult because is the time frame going to be as you're getting in phase 2 and 3, you've got to go back to phase 1 people, and that just seems like it's going to be a challenge. So I know you guys are up for it, but what's the thoughts on that?
That is always a complication when there's a 2-shot series. We're hoping that one of the vendors will eventually come out with a 1-shot. We always have recall systems to get people back for their second shot. So once you're in the system, you're automatically recalled through the registry. But of course, sometimes people don't come back. So we'll just keep working on it.
And I think that's part of, if I could just add to that, we discussed pods in that phase 1. So, a pod, like a healthcare system, sometimes they utilize their occupational health departments in order to do some of that when you have like a 2-shot or a 3-shot series, like a Hep B. They do that with the pod. Right. So within the healthcare system, because they keep that roster of who they're going to recall in. So that's one of the benefits of having that pod system in that first phase for the essential workers.
Yeah, the first phase will probably be the easiest.
Yeah. It'll be harder when it gets out further, getting people back for the second.
And do you know what the time frame is for the second? I know like a shingle shot, it's 2 to 6 months is after your first shot, they want you to get your second shot.
I think it's 30 days.
Okay. So hopefully there's possibly just a single shot for when we get to the next phases essentially get the first phase done. So, and no, honestly, the state on this has been doing a great job. I saw a presentation a couple of weeks ago from the State Department of Health to the County Association. And I guess the other question I'm going to have for you too, just on the radar, because I got we did another County Association meeting just on the new app that it's not an app, but it's something it's a tracking within the iOS systems of phones that you can opt in that supposed to be coming out November 30th to the state. At this point, they're just doing a test pilot at University of Washington with the students and community there. So they're seeing how that goes. But I would think if that is available November 30th, that would help us with tracking. It just informs you that you've been in contact with someone. If someone tested positive, that then to go get tested. Is my understanding. They're supposed to give us information, but they haven't given us any information on it. But that's going to be kind of the other thing I see that this group is going to be helping to, debunk this, that it's not tracking you. Everything's already tracked on your phone, but how do we do this and use this to help us get to the next, to when December 14th comes, that we have the virus under control and we can be opening back up instead of staying locked down. And so I'm just putting that out there in advance that that's something we just need to be aware of and how we're going to message that to our community as a means of helping those contact tracers, because you can't contact trace everybody. And so this would be a way to let an individual know you've been around somebody, longer than 15 minutes within 6 feet, that, just to be aware to pay attention and know. So making it so it's not area government tracking us, because understanding it's these key codes that they're doing that they don't identify the area, so they can't identify who it is or any of that, or even where it was. But it would just be a means of letting an individual know, if you choose to be part of that you've been around somebody who's tested positive. I think that's we need to think about, how we roll that out. The state will be rolling it out, but how that gets messaged, that, it's a means of just trying to keep the community safe, so then we can do the other things we want to do.
Yes, and I'm going to talk about that on communications a little bit when we get down to that area. So I just want to make sure if Lindia has more vaccine questions.
I did want to mention, usually with a 2-shot series, the first shot builds quite a bit of immunity up, and the second shot just kind of caps it off. So even if people don't get back for the second shot, that first shot's going to do a great job at immunity. All right, thanks.
So I have a question with regard to the Pfizer vaccination that they're proposing. So the news coverage in the last 24 hours is that it requires a little bit better, I would say, refrigeration than a lot of jurisdictions have under their control. Are you hearing any response to that in the planning stages?
Yeah, so the entities that are storing the vaccine had to buy a cold freezer, which is at a lower temperature than a lot of our freezers that we already normally have. So that has already been completed.
So we have that capability in this region?
We do.
Perfect, great.
Any other questions on vaccines before I talk communication? Okay. Yes, so you have maybe noticed, if you've been watching the Health District's Facebook feed and other social media, we have been working with Dr. Velasquez to really get some positive messaging and messaging back out to the community. I think that there were concerns that while we were getting the interim health officer named, that some of that communication had fallen off. And I can report back that I think our interim health officer has literally done a media communication something every day since he's been here, and he's only been here about 5 days. So we are working really hard to identify the communication and that needs to go out, including things like the iOS system that Commissioner Cooney discussed. And one of the other things that we're going to try to do is kind of mix up the communication a little bit by including some of the other experts that we have here at the Health District. So, for example, you may see Steve on camera with Dr. Velasquez talking about data. You might see an epidemiologist explaining infection rates or schools or other things. And one of the other things I want to add is that we're also trying to put some more messaging around hope, right? Because it's really been a lot, and I think even the community, right? Everyone has pandemic fatigue. So we're trying to figure out, we are where we are, and how do we just keep positively moving forward? So we're going to try to have some different spins on the communication. And knowing that kind of 20 to 29-year-old group is still a big area that we're trying to really work with. So if anyone has any topics that they would like included in that, or things that you think the community needs to hear that, you know, you're hearing people asking questions on, like, this would be a good Facebook live topic, feel free to shoot that email to me or let me know, and then we'll incorporate that into the schedule of media. Also, given the governor's rollback guidance, we're actually going to change up this meeting a little bit and go 100% virtual. So we're going to have some closures here in our building. So the next time we meet, we won't all be in the room together. We'll be in different offices on computers.
This is the only exercise Jerry gets.
I know. But I did want to check with the group now that the numbers are going up. You know, we had kind of gone to an every other week schedule. Does anyone want to go back to the weekly check-ins that will be virtual? Thoughts? Okay,
Yeah.
Mayor.
I see, Nadine, but I'll reiterate that too. I think doing a weekly at this point in time, I mean, we're at a, you know, kind of a crisis, not a crisis, but I mean, it's like the numbers are definitely way higher than they've been. And so we need to be having a conversation at least weekly, I think, you know, just so we all know where we're at, where we're going, what we can do to help, because, you know, with the mayor on, you know, maybe it's, you know, we look at doing some kind of combined, you know, press briefing to just really talk about the need to be, everyone to be safe and do the right thing so we can, you know, get back to business and get back to our schools and, you know, and provide that hope. So I guess I would say, you know, feel free to, you know, reach out, you know, to the county, and I won't speak for the mayor, but, you know, I think we all know we're in this together and we need to figure out how to help to move us forward.
Absolutely. I would say with the communication and the messaging part of it, the more we can do that collaboratively and regionally is that much stronger. So I think we should be pretty strategic about what that message is, and then all of us together being the messengers. I think it's a good idea.
Okay.
I guess I would chime in and agree. I think that a couple of things. First of all, with the numbers changing, you know, I think more frequent updates on what's going on with our capacity in the hospitals. Those things are critical, especially if we do get to a point where we need to consider an alternative care facility or anything else. And then the second thing is with the numbers going up and the connected additional restrictions that the governor's placed on, I think we need to be kept abreast as best possible of how this community is faring. And it's not just, you know, how are the businesses doing, but all of a sudden, are we starting to see changes with regard to our food availability? Certainly, some of us saw the news reports of extended lines in retail areas starting Sunday afternoon. So it's amazing what one press conference can do. So yeah, I think the more frequent updates are good.
Yeah, and kind of circle, Amelia, on one of Nadine's comments, or the mayor, sorry, is, you know, do you want to have kind of a communication team meeting, you know, kind of like at the EOC, just so it is a consistent message that, you know, they can, you know, we can all have come out. So to talk to Kelly and about doing that.
Yeah, I know Kelly is still communicating with the PIOs at each of those areas. So I think they talk weekly, but I'm going to circle back to her after this meeting just to say, you know, let's kind of up that priority. I mean, I know they talk, but this is more of like an assignment of let's figure out like what the next, what, you know, should be a press conference, an announcement, however we want to do that from all the partners. Anything in the chat, Anne? I'm not seeing anything. Okay. So we will plan, I guess next week would be the 24th. The 24th at 8 a.m. So Ann will send that meeting update out so everybody has consistent calendar information. Anything else before we adjourn?
So one more thought I have is if you guys are feeling overwhelmed with the businesses calling and asking, what the guidance is there a way to do just like a short video that then GSI could put on their website, we could put on our website, the city can, to help businesses and guide them during this time?
So all of the guidance is on our website. And I think if we can just direct people to actually go there and look at the guidance first. And then, I get this because everybody has a little different situation. And so they're wanting to kind of know the nuances within their business. But I think at some point, they're just going to have to make a decision on how to apply the guidance. But I think the more we can direct people to that website, the better.
But maybe
that communication.
right. Maybe that's the message. Like, if you're a business, here's where you go to do this. So
right. I think communication tool, Amelia, to and again, just everyone listens and learns differently too. So if we could have a video, I just think that would be really helpful. That's saying here's the guidance, here's where you go, but then this is kind of what it's saying. And at some point, if they need to make a decision, it's okay for them to take that guidance and use it best for their purpose to keep their customers safe or whoever it is.
Yeah, I wrote that down on my list for that I'll follow up with her on.
I have a quick question.
Hi, Katie.
Hi. So you guys have been doing a fantastic job. I just have to tell you that you guys have been through a lot, and I just appreciate all the communication, these meetings, and everything that you do. I don't understand all the logistics of what you do on a day-to-day basis, but I do have a question on the technology. So we are all in the public agencies in some way, shape, or form, either elected or appointed or whatever. And I know that I'm not really good at marketing, and I also know that I'm not really good at IT. So my question is, has the health district ever reached out to either academia or some of our startup tech companies or marketing firms to say, hey, can you help us on the technology or the marketing side? So that's just a question. I just know that it takes a huge amount of resources and expertise to do that. And I know that it's not in my wheelhouse, and I don't know that it's in your wheelhouse either. So just a question, but thank you for everything you're doing.
Yeah, so yes to both of those things. I know in terms of some of our messaging, we're currently working with the universities, specifically some of the sports teams, about doing some communication that we're not ready to release it yet, but we have been working behind the scenes for that. And then in terms of the technology, kind of yes to both. We work with a local company, and then we've also been updating some of our space just so that we can have broader bandwidth and more connectivity here at the health district. But yes, we've been working with outside groups to help us. So even the masking with that younger age group, that was all done by an outside firm.
Okay.
Yep.
Well, thank you.
Yep. Last questions? All right. Well, I will see you all next Tuesday at 8 a.m. Thank you.